Hello, I'm Dr. Ravindra. I'm the consultant orthopedic surgeon working here at Columbia Hospital, Whitefield. The most common cause for shoulder instability is fall on an outstretched hand, either a two-wheeler accident or slip and fall on the hand. And when this happens, patient usually rush to the emergencies and they get their shoulder joint relocated, and they are usually provided with a little sling support. The younger the patients, the more the chance that they go in for a recurrence of this instability with much lesser trauma in the future. That happens particularly when they try to do any overhead activities with the elbow moving back in the plane of the body, and this causes a lot of limitations in what they can do. All the overhead activities always pose a risk of recurrent dislocation.